All right. Welcome, Dr. Jenson. Jeff, thanks for joining us today. Really happy that you could spend some time with us and talk about really the power of prevention and how we can unleash that power. But before we get into that, I was just wondering if you could tell us a little bit about yourself and what your professional background is, and maybe a couple of, maybe your favorite things about prevention science.
Yeah, thanks. Well, thanks for having me, Nate. I'm really excited to be part of this series and the training you're doing. It sounds like a wonderful program you put together. Yeah, I just completed about 30 plus years as a professor of social work, most of those at the University of Denver. And I actually began my professional career as an elementary school teacher way back in the middle 70s. And I became interested as a teacher really in the young people who were having behavioral problems, who acted out in my classes, and became kind of more interested in that as a career track and trying to help and prevent those kinds of problems that young people have early in life. So that led me to social work really, and to training in social work at the University of Washington, where I was mentored by David Hawkins and Rick Catalano, who have gone on to be very influential in the prevention field, as you know. So that was really what led me to that. And I gravitated to prevention pretty early on as a way of trying to stop or eliminate the kinds of problems I was seeing as a school teacher, frankly, and then later in juvenile justice as well. So it was really about trying to get on the upstream of these kinds of problems. I think, you were asking about my favorite thing about prevention science, I think, and to me, it's the optimism that it delivers, or that it has the potential to deliver, and the fact that we can use good tools to help all young people develop in a healthy way and to live fulfilled lives and so forth. So it's a very optimistic kind of a frame of working on a significant problem that we have.
That's great. Yeah, I totally agree. Yeah, I appreciate that. And I think I've known you for 8 years now, and I didn't know a lot of that about you. So thanks for sharing that.
Yeah, sure.
Yeah, and so you come from a multidisciplinary background, and you mentioned David Hawkins, who our students will be watching a video and reading a paper by him and you for this module. And I want with other kind of first generation prevention scientists, we're often trained in fields outside of prevention science. So trained as sociologists or psychologists, social workers, criminologists, among others, where one might not these days kind of intuitively think that your work would emphasize a prevention science approach where you're focusing on these upstream risk and protective factors to keep individuals out of the behavioral health and juvenile justice system before they even get involved with it. Can you tell us a little bit about how a bunch of folks who were trained in fields like criminology and social work became early proponents and leaders in the field of prevention science? What value did you see in a prevention science approach?
Yeah, that's a great question, Nate. And it's kind of an interesting story. I know parts of it. I'm sure there's pieces I don't know, but it was indeed a group that came into prevention science, as you noted, from different disciplines. So criminology, psychology, social work to some degree. Something I've been working on my entire career is getting more social workers into prevention. But so it did kind of coalesce that way. Really kind of beginning in the late 1980s. And I think basically it was a group of people who were all in one way or another working on these embedded problems from more of a treatment perspective, really. So you had people that came from criminology who had seen the really, less than great outcomes of what happens after kids develop deep problems and enter the juvenile justice system. We have a hard time turning kids around, and rates of recidivism are high. And psychologists who saw that, young people had early problems with family members and and peers, and saw ways that really, I think, started to gravitate towards prevention, frankly, because of the less than effective alternatives that were in the field, in those respective fields. I think too, in the 1980s, people began to see the value, researchers and practitioners and policymakers to some degree, began to see the value of principles of public health and using principles of public health to try and help young people and families, develop healthily. And, we learned lessons from the medical field, for example, that we could prevent things like smoking and heart disease if we attack those risk factors, those things that were known to increase the likelihood of medical problems like, say, heart disease. We began to get messages from public health and the medical professions to the tune that, well, really what we need to do to reduce problems like heart disease is decrease the risk factors, things like smoking or being overweight or eating poorly, diet, exercise, all those common sense things now that we kind of take for granted. And I think a group of people really from these different fields got excited about that and said, well, why can't we use a similar approach to preventing behavior problems in kids? Why can't we develop lists of essentially risk factors that increase the likelihood of a young person getting involved in drugs or delinquent behavior or being aggressive or all the behavioral health problems we've come to know, and then in turn target those risk factors or try and reduce those risk factors through interventions. So I think two things were common, among people who gravitated to prevention science. One was this, maybe three, but one was this like, well, okay, we've tried a lot of things to treat kids. Let's get upstream and try and prevent these problems. Secondly, this notion that we can use these principles of public health, really, which are relatively easy to understand and convey. They're not as complex as many criminological theories, for example, that try to explain behavior, and they're more applied. So that was a second, I think, common feature. And a third was that I think it was a group of people, the first generation, if you will, of prevention scientists who really had an interest in designing interventions and developing interventions and testing those in rigorous ways. So we saw early on the Seattle Social Development Project developed by David and Hawkins and Rick Catalano, and life skills training created by Gil Botman in the 80s. And there's other programs that I know that your students will be learning and reading about from that first generation. And all those really targeted these risk factors in young people's lives and their family settings and in schools and among peers and in communities, and the protective traits that we knew would help young people thrive in the face of this risk. So I think those things kind of coalesced, and lo and behold, in the early 90s, there was a thing called prevention science, and a Society for Prevention Research was created, and the field kind of took off.
Wow, great! Yeah, thank you. That's a great context for our students.
Good.
So now fast forward to 2015, and we have this Unleashing the Power of Prevention. It's a pretty audacious title.
Yes, it is.
So how did you come up with that title? And what did you want to communicate to those practitioners, researchers, and policymakers about prevention science with that title?
Yeah, well, we talked quite a while about the right title for that paper. As a matter of fact, it got to be, humorous at times with different slogans coming back and forth and so forth. And we landed on this idea of unleashing the power of prevention. And everybody kind of lit up for us. Thought, well, that's great because it conveys a message that we wanted to get across in kind of a simple term, and people kind of they remember it. And really, what we were trying to convey in the title was that first, there's a lot of evidence supporting the effectiveness of prevention, and also a lot of evidence supporting the cost savings of prevention. So there were those two things, and that I think equates to the word power in the title, right? So evidence is power, and we need to use that evidence. And the using the evidence part is where we landed with unleashing, the word unleashing. So rather than saying, promoting evidence-based practices in prevention or something like that, we tried to come up with something that was a little more, that would stick in people's minds a little bit, but convey the same message. So unleashing to us meant using the evidence that we have, implementing tested and effective programs. And then the power really was the evidence part. So unleashing the power of prevention became our kind of way of talking to states and legislators and the field, really, and students as well. So I think that's the whole story on unleashing. There were I was trying to think of some other names we came up with that we rejected, but they escape me right now. But we've found this to be useful.
Yeah, it sounds like. I mean, I think it's a perfect title, and I think it really describes where the field of prevention science is. We're ready to unleash the power of this relatively new framework. And so,
yeah, that's a great point too. That's kind of exactly where we are. It's a lot about what works, and we're trying to. People like you and others across the country are trying to roll that out. So that's the unleashing part. Yeah.
Nice. All right. So. Since you published that paper, the Institute of Medicine paper on unleashing the power of prevention, which our students will be reading this module, do you believe that the power of prevention has been released? And what do you think are the next opportunities for prevention scientists to ensure that the power of prevention is unleashed in Colorado and across the United States?
Yeah, great question. Lots in there to think about. But well, to some degree, it's been unleashed. Of course, it's not complete by any means. We're well into some things, but we also have a lot of ways to go. Speaking to the opportunity side, I suppose. We've come a long way. If we look even further back than the 2015 paper, we've come a long way from the early prevention programs of the 60s, 70s, and 80s, where we just talked to kids about drugs and alcohol and use scared straight techniques and those kinds of things that we learned over time. In some cases were actually counterproductive, or they had no effect. So that's a little beyond your question of 2015, but there is that whole evolution of how we've made some significant advances, in a relatively short time, a couple of decades. So that's noteworthy too. But I think since 2015 in the paper, our group, we've tried to use those 7 action steps that are embedded in the Unleashing the Power of Prevention that your students will read about as a way of communicating to, in particular, states, because we've had probably the most effect working with states to this point. And we've used those steps to say, look, there are specific things that your state can do, whether it be the Office of Behavioral Health in the state or public health or even other, substance use, child welfare, so on. There's a lot of commonality here across these service sectors. So we've used those action steps to go in and help states develop plans. And I know you've been part of efforts, Nate, in Colorado to do that with the Office of Behavioral Health, for example, and that effort some of the unleashing the power of prevention principles and steps became embedded in a statewide prevention plan that the state is now rolling out in the second year of it. I think we did similar work in other states to getting back to your unleashing the power here. We did similar work in Massachusetts, where they have a promote prevent plan that was approved, and I and others from our team provided a lot of testimony there during that process. Excuse me. In Massachusetts, we worked a lot in our neighboring state of Utah because of a prevention champion over there that really got excited about our work. Sometimes that's what it takes. We found is getting that right person who is excited about prevention, and they can talk to the right people in their state to get some momentum going. So we've done that, and now we've seen in Utah pretty widespread implementation of, in particular, of life skills training in the state schools. So we worked kind of in a way that, I guess, two things were guiding us. One was we've really been promoting the use of effective programs. So encouraging states in particular and communities really to use programs that we know work. We refer people a lot to program registries, most notably the Blueprints for Healthy Youth Development here at CU Boulder, where you can learn a lot about effective programs. But we also know from our work over the years and since 2015 that that's really not enough. What we really have to do to get prevention programs in place is to work on these important infrastructure needs that states and communities have to deliver prevention programs. Providers want to deliver programs that work, in my experience, but they often don't have the support, the resources in some cases, or the kind of critical consulting knowledge that they might need to implement these programs. So you take a program like life skills training. Well, it requires some training to be able to deliver such a program, and it ideally you have ongoing consultation from someone involved in the program. Those are the kind of infrastructure supports that relatively few states have. Probably the most developed state in that regard is Pennsylvania, who has something called an epicenter, which your students may be reading about, I suspect, at some point, and that helps states deliver these programs. So it's kind of a convoluted answer here, I guess, Nate. So we made progress for sure. We made progress, and I'd say our most measurable progress has been in the area of working with these selected states, Washington and Pennsylvania. I'd include too Colorado, Massachusetts, and we've done some consulting with some other states too that didn't go quite as far. But in some of these states, we've been able to use these 7 action steps to help develop statewide plans. I think we've seen less progress at the federal level, frankly, since 2015. There were a couple of pieces of legislation that passed in 2017-18, the Family First Prevention Services Act, which brought really more of a prevention emphasis and focus to child welfare for perhaps the first time. And the Healthy Kids Act in 2017 had some prevention provisions as well. So there were a few pieces. I think now, turning to opportunities, looking forward, we have a change in administration, of course, and federal initiatives that are coming out that really parallel or align quite well with prevention. Things like early childhood childcare, early childhood education, family-focused policies that really are really align within our deep preventive in nature. So I think there's going to be new opportunities for people who are entering the field, getting degrees in prevention, whether it be prevention science, social work, other disciplines, who are interested in this notion of advancing prevention. I think the other thing, another opportunity is just for prevention is the entire focus and interest on behavioral health these days. It's a pretty big umbrella, but it includes a lot of things. But it's certainly a place where we as prevention scientists and practitioners and policymakers could live quite comfortably and integrate right into. And I've told many of my Master of Social Work graduate students that behavioral health is a perfect avenue. And don't forget to integrate prevention when you get in there. So yeah, we've seen progress. We know there's many more tested and effective programs being used across the country. It's a hard number to get at, by the way, because it's not real well documented. We know, you can talk to creators of some of the more well-known programs and get some rough numbers, but we certainly know that those programs have increased in number. Some states too. Quickly, just note that some states, like Colorado, is a perfect example of this, has used tax dollars from marijuana purchases that were legalized in the last decade in Washington and Colorado, and now in a number of states. So Colorado, for example, has used tax revenue from marijuana sales to fund prevention efforts, and probably the best known example of that is the implementation of a community prevention system called Communities That Care across the state, and it's in a number of counties now, as well as another prevention system known as Prosper that was developed in Pennsylvania. So that's another avenue that, frankly, we hadn't probably expected back some 10, 15 years ago, but it's been an important source of dollars and a way to promote prevention that we hadn't thought of before. So those are some of the things I think we've accomplished, Nate. There's others. There's certainly two. The research has continued to be strong in prevention. Prevention scientists, I think, have developed, rightly so, a very well earned reputation for doing good science and for being a group of people that translate science to communities, which I think is a really important part of what we all do.
Yeah, great. So yeah, it sounds like from what I'm hearing, this is a continuing process of, the word unleashing. It sounds to me like this is continuing to happen. We're continuing to unleash. You didn't use the word unleashed, or we've unleashed the power of prevention. We're continuing to build upon evidence-based principles and frameworks. And I really appreciated what you said about the field being one that is very empirically driven and using evidence to support the things that we're doing, because in the past, the field has had instances, maybe not in prevention science per se, but there have been programs that have been have caused not only been ineffective, but maybe have been iatrogenic or have had negative consequences. And so I think that prevention science is doing it right, that we're making sure that we're relying on the evidence before we unleash these programs into communities. So
yeah, that's exactly right. That whole translation of evidence to communities, and that's where those infrastructure pieces come in that I mentioned earlier. How to convey that information and get people to work with it in meaningful ways in communities and schools is really the biggest. Where we are right now, I think it's what we're trying to accomplish. So.
Great. Okay, so the last question I have for you is, I think a lot of our students are going to be either current prevention practitioners or aspiring or future prevention practitioners. What do you see as the role of prevention practitioners in unleashing the power of prevention?
That's a great question. I think there's a couple things. One is practitioners. For me, it's important that they understand and apply these principles of risk and protection as the work goes forward. I think we've made big advances using that kind of public health way of thinking about young people's problems. So understanding what those risk factors are, understand the importance of having to know the causes or at least the correlates, let's say, of problems like delinquency, substance use, mental health, before we dive in and implement programs. So understanding those key principles, I think, is important for practitioners. And then secondly, being aware of these tested and effective programs, I think is the second logical piece that practitioners need to keep up on. You know, their programs come along, new programs come along. Evidence continues to build on what works in schools and communities. So learning that evidence is important. You know, it's the kind of thing where you want a practitioner to be able to do the short elevator speech on what is prevention and why should we do it. You know, we get that a lot because people, policymakers in particular, don't. You know, and this is no slight on them, by the way, but understanding what prevention is sometimes is difficult, I think, because it's a big word, and it can mean a lot of different things. And in our world, we're really trying to prevent these behavioral health problems in young people. So how can practitioners? I think practitioners can become involved in promoting prevention practices too, by knowing the language of prevention, knowing about risk protection, knowing about the importance of linking risk and protection to the interventions that they select, so they can become really ambassadors of prevention themselves and help unleash the power, if you will, of prevention. And I think a related point, maybe we touched on it already, is that within behavioral health, I really think that practitioners have a unique ability right now to integrate prevention more fully, and to not only spread the message of prevention, but to convey this to supervisors and to administrators and other, the whole behavioral health care complex system, that indeed prevention works. Here's what we know. Can we look at these effective programs? Is there a way we can integrate a known program into what we already do? Things like that. I think those are all places where practitioners can be effective, and at a policy level too, offering testimony to bills that are before, in our state, the Colorado State Legislature, and other states. There's a parallel process where one can provide input and seek out leaders of political leaders who are interested in these issues that we're all interested in. And generally, it's easier than it might seem to people to do that. So that's another process I'd encourage practitioners to at least look at, as far as promoting what we know about what works. So those are a few things, Nate, that I think where we can go forward.
Great. Well, thanks a lot, Jeff. I really appreciated this, and you're obviously a wonderful ambassador of this work yourself, and just wanted to thank you for all your work that you've done in this space. And yeah, thanks a lot for joining us today.
Okay, well, great. It was really fun talking to you, and good luck to all your students and with the program. And it's a great thing that you're doing up there.
Great. Thanks, Jeff.
You're welcome.
Right.
Thanks.